Welcome to a special episode of our podcast, and we are celebrating the Hispanic Heritage Month, and we have a very special guest, as we promised. I would like to ask Haiti to do the honors and introduce our special guest.
Hello, everybody. Today is so exciting because we are so honored to have Dr. Ellis Gomez here with us today. We're so glad that you're here, Dr. Gomez, and we're so excited to learn and hear more about you. But first, I want to say a little bit about you, a little bio, just to share about you. So Dr. Gomez is a dedicated family medicine physician and she is a site director medical director at neighborhood health centers at the Latina location on Niagara Street. Dr. Gomez has been caring for the community since 1993, demonstrating a profound commitment to her patients and the west side of Buffalo. And she brings over 30 years of experience in primary care. And Dr. Gomez's passion for teaching extends beyond and her role as an associate clinical professor of family medicine at the University of Buffalo. And we're looking forward to learning more from her and her expertise on today and getting some insights. So Dr. Gomez, officially welcome and thank you for your commitment to our community here in Buffalo, New York.
Thank you. Thank you for inviting me.
Thank you. So we, and as Marcia said, we are, this is dedicated to Hispanic heritage. So we want to really hone into that. And the question that we have for you, so can you tell us, you've been in the community since 1993 and giving your time. Can you tell us a little bit about the key programs that you have implemented to improve the health and wellness of our community here in Buffalo, New York?
So that question is multi-layered. I think that it started when I was a medical student here at University of Buffalo. I did some volunteering, and actually I did some training and education in a family medicine office that was right across the street from Tops Niagara. And there I worked with two family physicians, actually one, and her name was Dr. Adriana Alvarez. She was the first one to really be a bilingual medicine provider in the West Side. I worked with her for about 3 weeks and got a taste of what it was like to work in the community. So it got me very interested in thinking maybe this is what I want to do when I graduate. Fast forward a few years, I finished my training. I did my residency in family medicine in Pennsylvania, and then came back to Buffalo. And I was able to get a job working with a doctor who basically, she was a mentor to me. I went and worked along with her and some other physicians, but we had 3 or 4 Spanish-speaking family physicians at that site back in the 90s, which is wonderful. As you may know, it's hard to attract professionals that speak Spanish into our community. Yeah. And so it was wonderful that we had that group of people. And at that time, it was run by the University of Buffalo Family Medicine and by Kaleida, which back in those days was actually Millard Fillmore Hospital. So it was a joint effort, and that was the first presence, I think, of primary care in the lower west side of Buffalo. So I think that is one of the major accomplishments or things that I was involved in, of just being part of that primary care presence, offering the services that our people needed. Otherwise, people went always to the emergency room. I came from the South Bronx, and my parents were Dominican and Puerto Rican, but we didn't have a family doctor, and we just went to the emergency room when we were sick, as many people do. And you wait there for hours and hours, and sometimes people get taken care of, sometimes they don't. There are many stories of people dying of a heart attack sitting in the
and the cost increases.
So this was, I was excited to join this group and to be part of primary care on the west side. At that time, the only other thing that existed was the Latina site had a hospital there that had a different name back then. It was basically a hospital, urgent care, and it had a lot of different people going through there. So it wasn't the same idea. Our site was trying to bring to the west side, here's your family doctor, connect with him or her, and stay with them for your lifespan,
Of course, get to know them.
Yeah, and get to know what preventive health is, taking care of your health and not just going for emergencies. That's kind of the backdrop. Fast forward several years, Kaleida Health felt that they couldn't sustain an outpatient clinic anymore, and they pulled out of funding primary care. Meanwhile, we had moved to my present location at 300 Niagara Street. That was the site of the old hospital. It was knocked down. It was rebuilt 18 years ago. So the building, was much newer than the one that was built in the 1900s. And We were so excited when that building was opened, and it was a big, big deal. A lot of politicians involved, getting millions of dollars to build that. So Kaleida pulls out, and then this presence that we had was going to disappear. And in came Neighborhood Health Center with the idea that we don't want this to close. This is a great opportunity. This is an area that needs primary care. And our CEO, Joanne Hafner, scooped in and said, we're going to rent this building, and we're going to try to retain some of the staff if we can. And anyway, in a matter of 2 weeks, it closed and it reopened.
Wow, 2 weeks?
It was just amazing that they were able to do that. So that's how I've been working on Niagara Street, first at 510 Niagara, and then at 300 Niagara for my whole career. And I've never.
So you have really seen the change and the growth of the need. And how it's been changed. The providing has been changing.
And I stressed that we were really the only game in town for a long time. Then came Dr. Vasquez down the street. He actually started at the office I was at too. We missed each other by a year, but he started there and then went off to make his own office and then build up what he built up. But that actually came from, our humble origins. There is Jericho Road, which is in the Upper West Side of Buffalo, and they came many years later, were mentored by our neighborhood health center also, because we're a federally qualified health center, and so is Jericho Road. So they were asking us a lot of questions about how to do things. That's the framework of where the background of healthcare in Buffalo. But some of the things that we've done recently, or in the last, let's say 15 years that I've been involved with neighborhood, actually maybe a little less than that. The first thing was taking over that building and offering care to our community. The second was trying to retain some of the providers who had already been working there, so that the patients felt comfortable coming and feeling like, yeah, this is a new name, but my doctor's still there. And a lot of people stayed and came because we stayed on. It was myself and 3 nurse practitioners that had been part of our group that actually all of them taught at University of Buffalo, the nurse practitioner school. We stayed on. Over the years, we've had more and more Spanish-speaking staff. We hire from the community, so more than half of our staff at my site speak Spanish, are bilingual. They are people from the community, which is great, and sometimes they see a lot of their friends and family coming in. So that's a great connection to our community and makes people feel at home. Another one of the things that has come about in the last few years, which is really exciting, is a grant called Cabrini.
Cabrini, yes. Yeah. And that is that connected to like Manhattan in New York, right? New York, Cabrini?
It's connected to the woman by the name Cabrini. The movie's about. She was a nurse and she brought healthcare to New York, to the immigrants. She was Italian, all of that. As a result of that, there's a lot of grants that have been given throughout the New York State to help train nurses. So we obtained a grant from this organization, and we're able to train people who work for us, basically to be medical assistants. So we have a lot of people who started as a receptionist. We call them patient service representative. They start as a receptionist, it's their first job, but then they like working here and they're like, I want to do something more. And we're able to offer this to them. And it really, we've had just a couple of graduations, a couple of classes, but it's been really, really rewarding to see that, not only providing jobs, but also training people to stay in the healthcare.
Yeah. And it's people from our very own community, from that same community, right?
Yes. Actually, one of my patients, it's a funny, interesting story. Her connection to our site is her mother was our receptionist when we were first starting across from Tops.
Wow.
So her mom worked with me and this other doctor for many years. She was a patient. I knew her as a patient. She asked me to give her a recommendation to work for us at Neighborhood. So I did that, and she got a job as a receptionist. So she didn't have any medical training or anything. So she loved it. She loved working here and being in the community. And then she was able to take advantage of that Cabrini grant, and she became a medical assistant. Wow. So I'm so proud of her.
That is awesome.
And she is a Puerto Rican woman who actually was just helping a lot of people herself, taking them to doctor's appointments, translating, like a lot of our relatives have done, right?
Yes, we all do that.
Dr. Gomez, something that I heard when you were telling us your story is about the building those relationships. And I think I heard that profoundly over and over. Your goal was for people to get to your office, just feel that they have a familiar face, that they know that they can trust somebody. So that trust, and what I hear is the trust and the building of that relationship was so key and a key component for your practice, and just building on now to have people that actually are learning and they're actually going out and helping more people. And that is very commendable. There was any personal story that you had that drove you to have that in mind and just have that passion to build those relationships in the community?
Yeah, I actually can think of a couple of examples, but one of the biggest ones is my own experience in my family. My mom had a heart condition and would go to the emergency room quite often. She didn't have a primary doctor. I just remember that experience of going with her and waiting and not knowing what's going on. My mom was a lot older than my dad, and she was probably in her mid-40s when she had me. So when I was a teenager, she was in her 60s and suffering from a lot of medical problems. So, you know, I saw it firsthand, and I saw that she had that episodic care that just, you know, when she's ill, when she's in a crisis. And I think that is one of the drivers for me. I also had an aunt that I mentioned that people die in the emergency room. She actually died, I believe, of a heart attack waiting in the emergency room in the same hospital where my mom and I would go. So, you know, having that experience, I think that made me interested in medicine. I first thought I was going to be a psychiatrist. I was interested in that. But, you know, then life, you know, changes you. And I realized primary care is what I wanted to do. I think the other piece of it was also seeing my mentor, Dr. Alvarez, and how she functioned in our community. She was Puerto Rican and Ecuadorian. So also a mixture, like we all are mixtures and mutts, right? She had that connection to the Puerto Rican community. She didn't grow up in Buffalo. She really felt connected. She went to medical school here, as I did. And watching her teach her patients, watching patients bring her gifts of food and stuff like that, you know, it just warmed your heart, and you knew that she was making a difference. People still remember her.
Really? Wow.
That's amazing, because I am from Ecuador, and I love the fact that my dad has a primary doctor. And I can tell my dad, I said, Dad, please go to the doctor tomorrow. And I know I trust him. And I think that is what I hear here, right? You want people to have someone that they know that they can trust, that they can feel at home. Because we are here, it's a new home, but we also are away from home. That's how I feel that we all are.
And someone that speaks the language, right? That is so important, that understands the culture and speaks the language, and they can express. Because I'm sure, as you know, Marcia, as your dad and, you know, and my mom, like just allowing them to express themselves is very different than someone translating for them, even if it's us, right? So I'm so glad to hear that there's such a support here in this community. You mentioned briefly in your bio, although we didn't say it, that, you know, you could have moved somewhere else, right? Practicing medicine somewhere else, but you decided to stay in this community. And you have been the beacon of all this, from what I see. You know, you have the story of how things happen. But do you find that nowadays it's more difficult to retain primary physicians in our communities with that passion that you have?
It is. There is something called the health. There's like a health science grant from New York State that it's actually sponsored, I believe, by HRSA. Tries to repay or pay back loans for healthcare professionals. Okay. So that is how we are able to get some of our providers through that grant. They will pay back their loans for a certain number of years as long as they continue to work for us. But what we find is that a lot of the younger, brand new primary care providers, they'll stay maybe 4 or 5 years if we're lucky. A lot of them, it's 2 or 3 years, and then they're moving on to something else. I feel that if they don't have a real connection to the community, they don't stay.
That's true.
But we actually just hired 2 physician assistants who are from the community. One actually grew up in the West Side and worked in Dr. Vasquez's office as a medical assistant, and then he went to physician assistant school. So he's fluent, he's from the neighborhood, people know him from the previous practice, and
Really?
they are connecting with him, which I'm very happy, because someday I'll have to retire and somebody has to.
Yes.
So, and we have another young man who is Colombian. So that guy's Puerto Rican, the other guy's Colombian. Don't know if he's going to stay in primary care. He actually is going to medical school right now. And he was working as a physician assistant. So he still works for us 2 days a week, and he goes to medical school. So that's really,
and that's what builds relationship, right? You're coming right from within, from the heart of the community.
Yeah.
And that's wonderful.
We had go ahead.
Yes, something that came to mind is, what can you advise us, or what advice you can give us just to create that awareness about finding somebody that speaks your language, like finding like people that can help you, like can communicate clearly. So what can we do?
I think that, we're very fortunate that there are so many healthcare centers now in the west side of Buffalo. So it's not that we have to travel far out of the community now. I know our patients don't feel like going to Williamsville is like going to another country, For them it's hard because they have to pay someone to take them there, or get, a taxi or something. So I feel that there are so many choices within our community that all you have to do is just, do a Google search, or if that's not available, ask, their children. A lot of older people don't do that, but the younger children can look for them. But there are so many places embedded in the community. Our office has 5 offices, 5 clinics, and 3 of them are on the west side.
That's awesome.
A couple are in Hamburg. One is in Blaisdell in South Buffalo. So there are those opportunities. There is the Jericho Road, which has a few sites as well. And even Evergreen used to be just care for people who are suffering with addiction, and now they've branched out to some primary care as well. But that there is so many resources available. I just wanted to mention a couple other things that we were doing in the community. I think that has helped Hispanic community, and one was nutrition classes. We've had a couple of bilingual nutritionists that worked for us. And one of them organized a 8-week nutrition class that at the end, if they finished it, they got a certificate, they got some kind of like gift card to Tops or something. And it was in conjunction with the Nutrition Society, as well as some of our insurance companies. I don't remember if it was Independent Health or Blue Cross. So it was one of the big ones. But that was something that we offered. The patients loved it. They learned how to make certain foods, ethnic foods, a little healthier.
Yes.
So that was really great. Another thing that we've worked with is with the homeless. We have had in the past a department that really reaches out and works with some of the students at the medical school to reach out and find people on the street. They're sleeping in the bus station, under the bridges, etc., and trying to bring them in and provide some kind of care for them, some kind of medical care.
Wow.
So those are other things that we've been involved in. And lastly, the pharmacy. We started a pharmacy at our site where I work, and now we have 3 pharmacies in 3 of our offices. As we have done that, Jericho Road copied us and did the same, and Dr. Vasquez's office also saw,
setting the tone again. Yes, that's wonderful.
And it helps our patients, because then we know how to get them the medications that their insurance won't cover, or we also offer them something called a sliding fee, which means if you don't have insurance, we'll look at how much income you have, and we will only charge you accordingly. Whether it's $5 or $10 or a certain percentage, but so you pay something, but it is in proportion.
Within budget.
Yeah.
In proportion to your budget.
Yeah.
That's amazing. And I think, I am new to the Western New York area. I'm just here 3.5 years. And little by little, I have been discovering so much opportunity and so much talent. And we are so grateful that we have you today, and you are sharing much information, availability, resources for all of us.
Yes.
And like Heidi mentioned, speaking the language is one of them. Like having somebody that can understand you and just have that compassion because you know how you feel. And we really want to say thank you and for all the insights and the impactful programs that you have been implemented to enhance the community, the health and wellness, and your dedication to improve is truly commendable. And now you're leaving a legacy,
Yes.
not only helping people like one-on-one, but also training them and just getting more people out there to help others. And that too, for us is amazing. And we are getting close to the end of our podcast. And we're so sad because we would like to have you here a whole afternoon.
I know, so much information.
I know, it's just listening to you, I'm like, wow, this is amazing. And Dr. Gomez, there is anything else that you would like to say, your final word before we end?
I think that I just want to thank you for the opportunity to talk. I have a passion for the community, as you see. I grew up in a community like this. I didn't grow up in Buffalo, but the community in New York City was very similar. I think that for that reason, I really have enjoyed the years I've worked and seeing different generations grow up in this community and in this city. And just being able to be a part of that has been a real blessing. So thank you.
Thank you so much.
Thank you. And we look forward to seeing your continued growth in the community and implementing and growing your legacy, basically.
Yeah. Thank you, Dr. Gomez. I really appreciate your time. Truly.
Thank you so much. Bye-bye.
Bye-bye. To our listeners, we appreciate your time and hope you found this episode informative. If you enjoy it, please let us know. We are going to leave all the descriptions and details about Dr. Gomez and all the accessibility that you can have to medical care. So please just take advantage of that. And we really appreciate Dr. Gomez for her time. So stay tuned for the next episode. We will have, another surprise guest. And we're so excited for that. Heidi, any last words?
This was such a good opportunity, and I hope that more and more people will log into our podcast, because we're really trying to bring people like this, like Dr. Gomez, who are really beacon of change in our communities and in health and wellness field and medical. So thank you all for watching, and be sure to follow us so you won't miss.
Oh yeah, thank you.
Bye-bye.